My experience as a therapist began with trauma therapy. I always had a specialized desire for trauma and treating addictions, chronic mental illness, and that's what brought me in the field of residential treatment. I wanted to put more of a personal approach from my background, experiences personally and professionally, and apply it to my patients. What brought me to Fairwinds was their individualized approach. There was a lot of positive feedback online in the mental health community, reputation-wise with Fairwinds and how they treat their patients. More individualized, interpersonal. It's a more smaller, intimate facility, so I felt like I could make a difference in a more home kind of environment and feel. The philosophies in treatment that I like to utilize is very person-centered, which means I'm going to focus on the individual and their individual needs. So I really do pride myself in taking time to sit with the patient, really understand what it is that they're dealing with, their spectrum of, life on their terms, and kind of help to guide them, walk alongside them, using cognitive behavioral therapy mostly. That's a shorter term approach, but it kind of just teaches the foundation that our thoughts really shape our emotions and our feelings, and that then leads to what behaviors they tend to use. And a lot of times, because of life situations and circumstances, there's a lot of negative thoughts that occur and happen due to childhood and things of that nature. So just kind of working on changing that narrative that they have about themselves to empower them a little more. And then that will help with the emotions. And then of course we focus on the behaviors, which is what they do. So if they are, harming themselves with eating disorder or with substances, we work to change that behavior to really help them find a more positive outlet for the emotions that they're experiencing. The advice I would give family and patients here at Fairwinds is to be an active participant in your treatment. We want to encourage you, we advise you to walk alongside us. So what that looks like for you is getting up, attending groups, asking the hard questions, challenging the staff if you do not understand, advocating for yourself, coming in with an open mind and an open heart that you are here for this help, and it takes a lot of vulnerability to ask for that help. And so to equally receive it, I feel is what is going to help people throughout their journey more than just us.